You have approximately 22 million individuals at large who have no access to cardiologists.
Welcome back to another edition of Conference Conversations. I have the pleasure today of having a conversation with Dr. Anthony Fletcher, President of the Association of Black Cardiologists, ABC. Please, Dr. Fletcher, first of all, thank you for with us
So this
today.
evening.
And then please tell us about ABC and its ever so important mission.
Well, thank you very much for this opportunity. ABC, the Association of Black Cardiologists, is an organization that's 50 years old. We actually celebrated our 50th anniversary this year. It's a group of cardiologists that started back in 1974, actually originated at the American Heart Association at that time. And it was a group put together to address the issues of underserved, marginalized populations. Our founders essentially were early beginners. They were early pioneers. In many cases, they were the first cardiologists in their class of color. And they wanted to get together to have a forum so that they could discuss common issues, whether it's issues related to our patient population, who were very often undertreated and underserved. They also wanted to address issues that at that time, there were no people of color who were looked at as experts, nor were there people on the stage presenting information at the conferences. So they wanted to kind of get together to make some changes in that perspective.
So, can you share a little bit about what you guys have done this year? I know you had a few programs
Yes.
this year. I'm sure that the Walter Booker Symposium was phenomenal, as it always is. Can you talk about the topics that you covered this year and about other programs that you had here
Absolutely.
at AHA?
So here at AHA, we certainly had a number of programs. We had our membership meetings, so to update the members as to the activities of the ABC this past year. We also had the Booker Symposium, which is a annual symposium that we have with a keynote lecture to talk about various forms of cardiovascular disease. We talked a lot about cardiomyopathy, talked a lot about amyloidosis, and areas that are underserved in the African American population, the importance of screening. And more importantly, we want to talk more about prevention. How can we get out into our communities, since so many of our communities are kind of into crisis management rather than prevention? So that was one of the key features of what we talked about at this meeting.
That is so excellent. And does ABC have specific programming throughout the year for prevention to address prevention?
Absolutely. We've initiated our pilot project this year. It's called Cardiovascular Desert Initiative. And that is an initiative where we're looking at the high-risk populations in the United States. And that happens to sort of run along the corridor of the low, mid-south, southeastern part of the United States. And these are areas where there's limited access to cardiovascular care. You have approximately 22 million individuals at large who have no access to cardiologists. Of those, 16.5 million are African Americans, and there are 2.5 million African Americans that live in areas where there are no cardiologists whatsoever. So this campaign is designed to help access those areas, to educate the individuals who live in those areas, and to also educate the providers who live in those areas, because many times, they're very busy primary care physicians trying to take care of multiple issues, multiple problems. They aren't perhaps able to keep up with the clinical guidelines. And so we want to help them be able to ascertain how to be preventive in this high-risk population. In this area, you're going to have the high incidence of diabetes, obesity, hypertension, which are three of the major risk factors for cardiovascular disease. And so we want to work with these communities to empower them, number one, to be educated about the signs and symptoms and the need for prevention, and then also the providers who take care of them to enhance them, to give them support in terms of helping identify and to treat these individuals.
That is such important work. And I was just going to ask you a question about what you're doing to address connected conditions, but your previous answer just shared what you all are doing at ABC. And it is phenomenal work. It's important work. And we are so grateful for the work you're doing in the community and hopeful that we can come alongside you and support you in future endeavors.
Well, we certainly appreciate that opportunity, and you actually can play a vital role, because part of this is communication. We have to be able to communicate to these committees and these communities the opportunities to be screened, communicate to them the importance of being screened, and to establish trust in these communities that people do care and are able to come in with perhaps some suggestions and some opportunities to be screened and treated early.
That is so key, especially in African American communities. As you well know, trust plays an important role in seeking care and seeking the medical advice you give, whether you act on it or not. And so thank you for all you're doing. Thank you for joining me for another conference conversation. It's my pleasure to have you again, Dr. Anthony.
Pleasure's sincere. Thank you so much. And let's do this again.
Yes, Dr. Anthony Fletcher, President of the Association of Black Cardiologists. I'm Rhonda Monroe for HeartLife.
Thank you.